JAHJAH Foundation means Jamaicans abroad helping Jamaicans at home. JAHJAH Foundation. This morning as I'm packing my suitcase to get on the plane, my kids came to me and said, "Daddy, you going to Jamaica again?" And I love my kids a whole lot, and I hate to have to leave them to go on a medical mission. But I know it's very important that as much as my kids need me, there are children in Jamaica also who needs me. Not as much as my children, but they still need me to do my part. And giving back to them, giving back to those who don't ask for anything, to me is the best giving of all. When people don't ask you for anything and you can see that they have a need and fulfill that need, I think that says a whole lot. So giving back is something that's in my DNA. I was speaking to one of my friends who's a psychiatrist, and he said that he finds that a lot of people who actually give back through altruism, it's kind of in their DNA in the sense that they don't feel like they have a choice but to give back. And that's how I feel. I don't think I have a choice. I have to give back. That's what is expected of me. To whom much is given, much is expected. I can drive a $500,000 car, $250,000 car, but at the end of the day, when you reach the pearly gates and the man says, "What have you done with your life?" To tell him that you bought a $500,000 car or a $250,000 car, I don't think that's the answer he wants to hear. So I do my part because I know what is expected of me. To whom much is given, much is expected. Well, when it comes to donations and the JAHJAH Foundation, we find that most of the donations that we get are from people who know me locally, who know the work that I'm doing. They're familiar with what I'm doing. What we need to do is to stretch that donation into people who can go on the webpage and see the work that the JAHJAH Foundation is doing. We have a Facebook presence at jahjahfoundation.org where people can go and see our work in motion. We believe that the proof is in the pudding. If you can see the work that we're doing, you should be happy to give back to the people of Jamaica, because we have the videos online so you can see in Jamaica what we do in the dance hall with the HIV project, what we do at the Mango Hall Basic School, and what we do in collaboration with the Kingston Public Hospital, the Ultrasound workshop in Kingston. These things are there so you can see why you should give back to the JAHJAH Foundation and how your dollar goes directly to the people of Jamaica. See you in Jamaica. The flight down was uneventful, smooth, and we landed in Jamaican fashion. All the Jamaicans clapped.
Right? This is normal. This is what it's supposed to look like. That's called lung sliding, ants marching. It looks like, the pleural line is kind of shimmering. Okay? That's normal. It's supposed to look like that.
Over here we have fluid above the diaphragm, right? So again, you shouldn't see this white line back here. It should stop right at the diaphragm. And this is the indication that you're going to have fluid behind it. Sometimes you're not going to see the black, you're not going to see the fluid.
Rib shadow, rib shadow. This is the pleural line here. I know it's not great, guys, but it's not doing anything. All you can see, yes, you can see some movement, but that's basically just your intercostal muscles kind of just pulling on the chest.
I'm Dr. Nordia Thompson, emergency medicine resident at the University Hospital of the West Indies, a second-year resident. So far for the course, first I must say thanks to the JAHJAH Foundation as well as the Kingston Public Hospital for putting on this course. So far today we have gone through a number of different use of the ultrasound in emergency department, which is crucial to improve our competence in this area to better manage our patients. It has been great so far and eye-opening, and certainly has helped to improve my competence in ultrasound use in the emergency department.
Hi, I'm Dr. Lissandra Spencery from Kingston Public Hospital. I work in the Department of General Surgery. The ultrasound course so far from JAHJAH Foundation has been very, very good for me personally, because I've always wanted to be, you know, to be able to do or to use ultrasound to assess my patients or to assist in my clinical assessment of my patients to further aid my patients. And this was very, very good. I'm very thankful to Dr. Trevor Dixon and his team to have put this on for us from KPH.
That looks like the IBC.
And where does it meet where it
You
is?
need to kind of rock the probe just to see if you can get the heart.
Oh, yeah. Putting it, angling it upward.
Kind of coming in to the left of the screen. Sometimes you have to go up a little bit more. Can you see the right atrium kind of there? Yeah, right.
Go for it. Take over.
Wait, let me go back this way.
You want to go along the axis of the heart.
I think you got it right there.
My name is Dr. Omar Wallace. I'm a medical officer in the emergency department at JAHJAH Hospital. Here attending the Ultrasound Conference presented by JAHJAH. I think this is something that is extremely important and necessary. Not only in emergency setting, but however across all departments, because this is the use of the ultrasound is becoming increasingly more significant in the rapid diagnosis and hence posterior treatment and effective treatment and management of the patients. I hope this is something that is done routinely, right? As myself and as my other colleagues will benefit greatly from the continued exposure to this type of information. Thank you.
Hi, my name is Alicia Johnson Samuels. I work at the Kingston Public Hospital and I'm from the Department of Anesthesia and Intensive Care. This ultrasound workshop put on by the JAHJAH Foundation I find is a good one because we get the practical hands-on experience in addition to the theoretical information. And I think it's good experience and exposure for the residents in the system because it allows us to practice before we actually have the critical patients in front of us. I think that the work that the JAHJAH Foundation is doing in Jamaica will impact healthcare locally and for years to come because the information that we learn here we can pass on to our colleagues that were not able to come to the seminar. So I think the work is very good and they are making an impact now and an impact for years to come.
The easiest way is find the transverse, and once you're on transverse, turn it. Right there, right there. So you got it. So try to get in the middle of the screen as possible, best as possible.
They're tiny veins, right? They're not as wide as this. So the tendency is for the probe to slip like that and you're gonna lose it. But once you get it and it shows up how I had it, you're gonna have the probe right over the vessel like this. Then you're gonna go in with your needle. And this time you see right where this is. This is what makes this technique so difficult. You wanna put your needle right where that is so that you're going to come in right over it. Oftentimes when you enter, you should see the tip of your needle show up like hyperechoic, so bright white. He show the tip of the needle. Oftentimes when you hit it, if you don't see the tip of your needle, you're very close. So what I typically will do is as I go in, if I don't see the tip of my needle, I will either go that way and sometimes the tip will show up.
Remember, you can use color to help you out. So these are vessels, right? There's no flow there. So you're just above it, and you just gotta fan through. Right there. Okay, so once you have it.
Hi, my name is Monique Brown. I am currently at the Kingston Public Hospital, Accident and Emergency Department. So currently, I'm here at the JAHJAH Foundation Ultrasound course, and it is a very enlightening experience. The course equips us with a great skill set, and definitely in the emergency department, this would be a very, very good asset for all of us. So I commend the foundation, and I would love to see the course extended straight across the island to all the emergency physicians.
Hi, I'm Dr. Maxine Nelson. I'm an accident and emergency physician at KPH A&E, and I'm currently here at the JAHJAH Foundation Ultrasound course, which I have found to be very interactive and very informative thus far, and I must say that this will indeed help me a lot in my future endeavors as a physician. I also applaud the efforts of the JAHJAH Foundation and implore them to continue doing their excellent work that they've been doing just far.
The best way to assess ejection fraction is to have been doing it so much that you can look in the heart and, oh yeah, that's 30%.
Down, or it's normal, or it's this or that.
So it's just pattern recognition. All we're teaching you today is pattern recognition. When you see a pattern, you'll be able to identify what pattern you say. You put it in your mental library and say, okay, when Hackett gave the presentation, hyperdynamic heart, that was 65%. Eventually you'll see enough and you'll be able to tell an EF just by looking at it. Maybe 6 or 7 frames.
You can do that, but I typically start with the transfer.
EPSS works because the heart stretches, the left ventricle stretches, and then the distance becomes greater because the heart stretches.
The next vessel I see running right next to it is going to be the air. So all I do is I stay where I am and I just fan the probe, and there's the air. And you see how it's and it's pulsating. And then I just fan back slowly to the right. If you watch the movement of my arm here, and it's just small. Now I'm on the IVC, and this is the movement I make to get them onto the aorta.
You're doing one, doctor. Do you see your needle? And he says, I don't see my needle. So you're gonna do something ultrasound guided, and you have to look for it. You don't see? Does anybody see his needle?
Yeah.
Help the doctor out.
On the other side, opposite side.
Oh my God, there you go, all right, you found a needle.
I'm Dr. Andre Sargent, and I work in internal medicine at the St. Anne's Bay Hospital. I have found this conference to be the most empowering I've been to in a long time, because it not only gives you academic benefit but also practical applications for ultrasound in our practice, and this will greatly benefit our practices across the island, improving healthcare, improving patient survival, diagnosis, everything. So just want to thank the JAHJAH Foundation for this wonderful opportunity.
Trudy and Johnson Hilton. Shamika Hughes. Dr. Monique Brown.